Hello everyone, now let us discuss about 2023 changes in the coding guidelines for cardiac catheterizations. This comes under the medicine chapter of CPT under the subsection cardiovascular. Now coming to the new codes that have been added in the 2023. The first one is 93569, which is for selective pulmonary arterial angiography unilateral. This code is added, which is indicated by circle, and this is an add-on code. The next is 93573 for selective pulmonary arterial angiography bilateral. This is also new code. The next is 93574 for selective pulmonary venous angiography of each distinct pulmonary vein during cardiac catheterization. The next is 93573 for selective pulmonary angiography of major aortopulmonary collateral arteries arising of the aorta or its systemic branches during cardiac catheterization for congenital heart defects, each distinct vessel. And next is a revised code. This code has been revised 93568 for non-selective pulmonary arterial angiography. For selective pulmonary arterial angiography unilateral, you need to report 93569, which is a new code, and the revised code for non-selective pulmonary arterial angiography is 93568. These are the new revisions and additions. Now let us discuss about the deleted codes. The code 93530 has been deleted, and to report you need to see 93593 and 93594. And similarly, the codes 93531, 532, 533 have been deleted. In order to report them, you need to see 93462, 93596 and 597. Similarly, 93561, 562 have been deleted. For cardiac output measurements, thermodilution or other indicator dilution method performed during cardiac catheterization for the evaluation of congenital heart defects, you need to use the code 93598. So the overall codes that are deleted are 93530, 531, 532, 533, 561, 562. Coming to the introduction of cardiac catheterization. Cardiac catheterization is a diagnostic medical procedure which includes introduction, positioning and repositioning when necessary of the catheters within the vascular system, and then recording of the intracardiac and or intravascular pressure and the final evaluation and report of the procedure. All these things are included in the cardiac catheterization. And there are two code families for cardiac catheterizations, one for congenital heart diseases and one for all other conditions. And for cardiac catheterizations for the congenital heart defects, the code range is 93593, 594, 595, 596, 597 and 598. And they are dealt in the cardiac catheterizations for congenital heart defects subsection. In the current session, we will discuss about the guidelines that apply to cardiac catheterizations performed for indications other than for the evaluation of congenital heart defects. Now first coming to right heart catheterizations for indications other than the evaluation of congenital heart defects. The code range are 93453, 456, 457, 460 and 461. They include the catheter placement in one or more right-sided cardiac chamber or structures, that is right atrium, right ventricle, pulmonary artery, pulmonary wedge. Obtaining blood samples for the measurement of blood gases and cardiac output measurements, FIC or other method when performed. And for placement of a flow directed cataract, for example Swan GANs, performed for the hemodynamic monitoring purposes, not in conjunction with other catheterization services, you need to use the code 93503. For the placement of flow directed cataract, for example Swan GANs, performed for the hemodynamic monitoring purposes, not in conjunction with other catheterizations, you need to use the code 93503. and do not report 93503 in conjunction with other diagnostic cardiac catheterizations. Right heart catheterization does not include right ventricle or right atrial angiography. This is important. Right heart catheterization does not include right ventricle or right atrial angiography, which is given by the CPT 93566. Whenever atrial angiography is performed in addition to right heart catheterizations, you need to report this code separately, 93566. For right heart catheterization, as a part of catheterization to evaluate the congenital heart defects, you need to refer the codes catheterization for congenital heart defects that come under the following category. And for reporting purpose, when the morphological left ventricle is in subpulmonic position, for example, certain cases of transposition of the great arteries, that is, they are not in their regular position due to congenital heart disease. Catheter placement with hemodynamic assessment in this structure in left ventricle during the right heart catheterization. Catheter placement in left ventricle during the right heart catheterization is considered as a part of right heart catheterization only and does not constitute left heart catheterization. Position of the left ventricle is a little different, and placement of catheter in the left ventricle for the right heart catheterization during the right heart catheterization is considered as a part of procedure and not constitute the left heart catheterization. Second case, when the subpulmonic ventricle also connects to aorta. In this case, the catheter placement with hemodynamic assessment of this ventricle, that is left ventricle during the right heart catheterization, is considered as a part of the procedure, while catheter placement with hemodynamic assessment of the same ventricle, left ventricle from the arterial approach, is considered as a left heart catheterization, especially when subpulmonic vessel ventricle also connects to aorta, that is double outlet right ventricle. In this case, whenever the catheter placement with hemodynamic assessment to left ventricle from the arterial approach is considered as left heart catheterization, not right heart catheterization. The next scenario is report the appropriate code for right and left heart catheterization if the catheter placement with hemodynamic assessment of the double outlet right ventricle is performed both during the right heart catheterization and separately from the arterial approach. From arterial approach, you need to code the left heart catheterization. But for the right heart catheterization, you need to use the right heart catheterization only. Whenever aorta is involved and for that subpulmonic ventricles, you need to consider it as a left heart catheterization, not as a part of right heart catheterization. And the right heart catheterization for the congenital heart defects does not typically involve thermodilution cardiac output assessment. Right heart catheterization for congenital heart defects does not typically involve thermodilution cardiac output assessment. When thermodilution cardiac output is performed in this setting, it may be separately reported using 93598. Coming to left heart catheterizations for the indications other than congenital heart defects. The codes are 93452, 453, 458, 459, 460 and 461. It involves catheter placement in the left side cardiac chamber, left ventricle or left atrium, and includes left ventricle or left atrial angiography imaging supervision interpretation when performed. For reporting purpose, when the morphologic right ventricle in the systemic position, subaortic position due to congenital heart disease, for example, certain cases of transpositioning of the great arteries, catheter placement with hemodynamic assessment of the subaortic ventricle performed during the left heart catheterization is considered as a part of the procedure and does not constitute right heart catheterization. In addition, if the catheterization of the right heart structures, for example, atrium, pulmonary artery, is performed at the same setting, report the appropriate code for right and left heart catheterization. If the additional catheterization of the right heart structures, for example, atrium, pulmonary artery, is performed at the same setting, then you need to report the appropriate code for right and left heart catheterization. And left heart catheterization is performed using either transapical puncture of the left ventricle or transeptal puncture of an intact septum. Report 93462 in conjunction with the following codes. And for left heart catheterization services for the evaluation of congenital heart defects, you need to refer 93565, 595, 596 and 597. Now the second case is catheter placement and injection procedures. Normal cardiac catheterization is different in that catheter placement with the catheter placement codes are different. Cardiac catheterization other than for the evaluation of congenital heart defects include all road mapping, angiography in order to place the catheters, any injections for angiography of the left ventricle, left atrium, native coronary arteries or bypass graft listed as inherent to the procedure in the cardiac catheterization, image supervision, interpretation and report. All these things or services are included in the cardiac catheterizations. And do not report 93563 and 564 and 565 in conjunction with 93452, 453, 454, 455, 56, 57, 58, 59, 60 and 61. The cardiac catheterization codes do not include contrast injections and imaging supervision, interpretation and report for imaging that is separately identifiable other specified procedure. The cardiac catheterizations does not include contrast injections. They include any injection for angiography, but they do not include contrast injection and image supervision, interpretation and report for that imaging is separately identifiable procedure. And catheter placement in coronary arteries involves selective engagement of the origins of the native coronary arteries for the purpose of coronary angiography. Involves the selective engagement of the origins of the native coronary artery for the purpose of coronary angiography. And catheter placements in bypass grafts. It can be venous, internal mammary, free arterial grafts, anything. Involves selective engagement of the origin of the graft for the purpose of bypass angiography. Bypass graft angiography is typically performed only in conjunction with coronary angiography of the native vessels. Bypass graft angiography is typically performed only in conjunction with coronary angiography of the native vessels. And the codes for the catheter placement in native coronary artery that come under the series 934542, 93461 and the bypass graft codes are 93452, 93461. Include intra-procedural injections for coronary or bypass graft angiography, image supervision and interpretation except when these catheter placements are performed during cardiac catheterizations for the evaluation of congenital heart defects. And do not report 93563 to 565 in conjunction with 93452 to 93461. For right ventricular or right atrial angiography performed in conjunction with right heart catheterizations for the non-congenital heart defects or disease, or for the evaluation of congenital heart defects, you need to use the code 93566 because this is not included. Atrial angiography is not included in cardiac catheterizations. For reporting purpose, angiography of the morphologic right ventricle or morphologic right atrium is reported with 93566 when these structures are in the standard pre-pulmonic position or in a systemic position, that is sub-aortic position. Angiography of the morphologic right ventricle or right atrium is reported with 93566 whenever they are in subpulmonic and subaortic positions. And left heart catheterizations performed for non-congenital heart defects or disease include left ventriculography whenever performed. The left heart catheterizations performed for non-congenital heart diseases, they include the left ventriculography whenever performed. And for reporting purpose, angiography of the morphologic left ventricle or left atrium is reported with 93565 when these structures are in standard systemic, that is subaortic position or in pre-pulmonic position. One important point is we should not report 93565 in conjunction with 93452, 453, 454, 455, 456, 57, 58, 59, 60 and 61. For cardiac catheterizations performed for the evaluation of congenital heart defects, left ventriculography separately reported. For cardiac one important point is for cardiac catheterizations that are performed for non-congenital heart defects, in that case left ventriculography is included. But for cardiac catheterizations performed for the evaluation of congenital heart defects, left ventriculography is separately reportable with 93565. And for cardiac catheterizations for both congenital and non-congenital heart defects, supraalveolar aortography is reported with 93567. Supravalvular or aortography. Supravalvular aortography is reported with 93567. And for cardiac catheterizations for both congenital and non-congenital heart defects, pulmonary artery angiography or selective pulmonary venous angiography is reported with the appropriate pulmonary angiography codes 93568, 569, 73, 74 and 75 plus appropriate cardiac catheterization codes. When contrast injections are performed in conjunction with cardiac catheterizations for congenital heart diseases, then you need to see the codes 93563, 564, 565, 66, 67, 68, 69, 73, 74 and 75. And this injection procedures represent separately identifiable services and may be reported in conjunction with one another whenever appropriate. And they include image supervision, interpretation and report. And for angiography of non-coronary or non-pulmonary arteries and veins performed as a distinctive service, use the appropriate codes from radiology section and the vascular injection procedures subsection in the surgery cardiovascular system session. For angiography of non-coronary and non-pulmonary arteries and veins performed as a distinct service, you need to use the appropriate codes from the radiology session or vascular injection procedure subsection in the surgery cardiovascular system. For non-selective pulmonary arterial angiography, you need to use 93568. Non-selective pulmonary arterial angiography code is 93568. For selective unilateral or bilateral pulmonary angiography, the codes are 93569 and 93573. And for selective pulmonary venous angiography, you need to use 93574 for each distinct vessel. And for selective pulmonary arterial angiography of major aortopulmonary collateral arteries. Major aortopulmonary collateral arteries arising of the aorta or its systemic branches, use the code 93575 for each distinct vessel. And the injection procedures 93574 and 75 represent selective venous and arterial angiography respectively for each distinct vessel. And these codes 93574 and 75 require evaluation of distinct named vessel, right upper pulmonary vein or left lower pulmonary vein, left pulmonary artery via Ballock Tussing, BT shunt axis, major aortopulmonary collateral artery vessel 1 from underside of aortic arch, and may be reported for each distinct named vessel evaluated. And each pulmonary angiography codes for cardiac catheterization include selective angiographic catheter positioning, injection, radiological supervision and interpretation. These codes, they include all these services. 93569, 573, 574 and 75. They include selective angiographic catheter positioning, injection and radiological supervision and interpretation. The next is adjunctive hemodynamic assessment. When cardiac catheterization is combined with pharmacological agent administration with the specific purpose of repeating hemodynamic measurements to evaluate hemodynamic response, then you need to use 93463 in conjunction with the catheterization procedures. And do not report 93463 for intracoronary administration of pharmacological agents during the percutaneous coronary intervention procedures, during intracoronary assessment of coronary pressure, flow or resistance, or during intracoronary imaging procedures. You should not report these codes for these procedures. Intracoronary administration of pharmacological agents during percutaneous coronary intervention procedures, intracoronary assessment and intracoronary assessment of coronary pressure, flow or resistance, or during intracoronary imaging procedures. And do not report 93463 in conjunction with 92920 to 92944 and 927, 92975 and 92977. When cardiac catheterization is combined with exercise, for example, walking or arm or leg ergometry protocol with specific purpose of repeating hemodynamic measurements to evaluate hemodynamic response, then you need to report 93464 in conjunction with cardiac catheterization procedures. The contrast injection to map the axis size for the specific purpose of placing a closure device is inherent to catheterization procedures and cannot be reported separately. Contrast injection to image the axis site for the specific purpose of placing a closure device is included in the service and not reported separately. Closure device placement at the vascular axis site is inherent to the catheterization procedure and not separately reportable. Now here you can see the various catheterizations. They include right heart catheterization, left heart catheterization and combined right and left heart catheterization. The code for right heart catheterization is 93451. Code for left heart catheterization is 93452. Code for combined right and left heart catheterization is 93453. Now coming to catheter placement in angiography. It can be native vessel or bypass graft. Catheter placement in angiography. Catheter placement in angiography with the right heart catheterization, with the left heart catheterization, with the combined right and left heart catheterizations. Codes are categorized based on side of catheterization. Anatomical site of the heart where catheterization is performed. Now, catheter placement in coronary artery for coronary angiography. The code is 93454. For the catheter placement in coronary artery for coronary angiography, the code is 93454. And the code for catheter placement in the bypass graft for bypass graft angiography is 93455. And catheter placement with code for catheter placement with right heart catheterization is 93456. Catheter placement with right heart catheterization in bypass graft by bypass graft angiography is 93475. 457. Catheter placement with right heart catheterization is 93456. This is for native coronary artery. The code for catheter placement with right heart catheterization and bypass graft for bypass graft angiography, the code is 93457. Next is catheter placement with left heart catheterization. And the left heart catheterization, whenever performed, it includes left ventriculography is included whenever performed for non-congenital heart defects. Catheter placement with left heart catheterization, the code is 93458. Catheter placement with left heart catheterization in bypass graft for bypass graft angiography, the code is 93459. And catheter placement with right and left heart catheterization, the code is 93460. With right and left heart catheterization in bypass graft for bypass graft angiography, the code is 93461. These are the various catheterization codes. Now coming to detailed CPT description, 93451 is the first code. It is employed for right heart catheterization, including measurement of oxygen saturation and cardiac output when performed. And here are a list of codes along with which 93451 cannot be reported. Do not report 93451 in conjunction with these following codes. And similarly, do not report 93451 in conjunction with this following set of codes. Next is 93452. This involves left heart catheterization, including intra-procedural injection for the left ventriculography, image supervision and interpretation when performed. Here also are the list of codes that cannot be coded together with 93452. Do not report 93452 in conjunction with so and so codes, and do not report 93452 in conjunction with these codes. The next is 93453. Combined right and left heart catheterization, including intra-procedural injection for left ventriculography, image supervision and interpretation when performed. Every code has do not report so and so code in conjunction with the respective codes. That indicates that we should not code these two codes together. Next code is 93454. Catheter placement in coronary artery for coronary angiography, including intra-procedural injection for coronary angiography, image supervision and interpretation. It is given by 93454. Next is 93455. It includes with the catheter placement in bypass graft. Previously it was native coronary artery. Catheter placement in bypass graft is given by the code 93455. Catheter placement with right heart catheterization is given by the code 93456. So before going into the code 93457, we have to remember the point that bypass graft angiography is typically performed only in conjunction with coronary angiography of the native vessels. Separately, we will not perform the bypass graft angiography. Bypass graft angiography is typically performed in conjunction with coronary angiography of the native vessels. So, the code description of 93457 is catheter placement in coronary artery for coronary angiography with catheter placement in bypass graft. It can be internal mammary, free arterial, venous graft, including intra-procedural injections for bypass graft angiography and right heart catheterization. Here the catheter placement in coronary artery for coronary angiography is done along with catheter placement in bypass graft and right heart catheterization. The next code is 93458. Whenever catheter placement in coronary artery for coronary angiography is done with left heart catheterization, coronary angiography, catheter placement in coronary artery for coronary angiography is performed with left heart catheterization, including the intraprocedural injection for left ventriculography. The code is 93458. Next code is 93459. Here, catheter placement in coronary artery for coronary angiography with left heart catheterization, including intraprocedural injection for ventriculography whenever performed, and catheter placement in bypass graft with bypass graft angiography. The code is 93458. The next is 93460. Here, catheter placement in coronary artery for coronary angiography with right and left catheterization, including intraprocedural injection for left ventriculography when performed. Both, that is coronary angiography with right and left heart catheterization. The code is 93460. The next is 93461. Coronary angiography with right and left heart catheterization and catheter placement in bypass graft with the bypass graft angiography. The code is 93461. And below is the list of codes along with which we cannot use 93461. Below each code you will find this do not report set of guidelines. Do not report means you should not use both codes in conjunction. The next is an add-on code plus 93462. Left heart catheterization by transeptal puncture through intact septum or by transapical puncture. This is an add-on code and must be reported in addition to the primary procedure code. And this can be used in conjunction with these following set of codes 33477 to 93454 or 93590 to 93591. Next is use 93462 in conjunction with 93581 for transeptal or transapical puncture performed for percutaneous transcatheter closure of ventricular septal defect. And do not report 93462 in conjunction with 93656. And do not report 93462 in conjunction with 93590 for transeptal puncture through intact septum performed for left heart catheterization and percutaneous transcatheter closure. You should not use 93462 in conjunction with 93590 for this particular procedure. And do not report 93462 in conjunction with 33418 and also 0345T, 0544T unless transapical puncture is performed. The next is also an add-on code plus 93463. Pharmacological agent administration. Example, inhaled nitric oxide, intravenous infusion of nitroprusside, dobutamine, milrinone or other agent, including the assessing hemodynamic measurements before, after, during and repeat pharmacological agent administration whenever performed. This is used when the pharmacological agent is administered for the assessment of hemodynamic measurements. The next is 93464. For physiological exercise study, example bicycle or arm ergometry, including the assessment of hemodynamic measurements before and after. This is also an add-on code. The next code is 93503. Insertion and placement of flow-directed catheter. For example, Swan Gans. For monitoring purpose, insertion and placement of flow-directed catheter for monitoring purpose. Next is 93505 is used for endomyocardial biopsy. Here are the set of deleted codes 93530, 93531, 532, 533, 561, 562. This we have discussed in the earlier session. In the beginning of the session, we have discussed what codes are deleted. And in order to report them, you need to see these following codes. The next is also an add-on code plus 93563. This is used for injection procedure during cardiac catheterization, including imaging supervision, interpretation and report for selective coronary angiography during congenital heart catheterization. The next is also an add-on code plus 93564 for selective opacification of aortocoronary venous or arterial bypass grafts. Example, aortocoronary saphengeal vein, free radical vein, free mammary artery graft to one or more coronary arteries, and in situ arterial conducts. For example, internal mammary, whether native or used for bypass to one or more coronary arteries during congenital heart catheterization when performed. It must be used in conjunction with 93582, 593, 594, 595, 596 and 597. 93564 is used for selective opacification of aortocoronary venous or arterial bypass graft. The next is also an add-on code plus 93564 for selective left ventricular or left arterial angiography. The next is 93566 for selective right ventricular or right atrial angiography. The next is 93567 for supravalvular aortography. These procedures are not included in the catheterization and they must be coded whenever they are performed. 93566 for selective right ventricular or right atrial angiography and 93567 for supravalvular aortography. The next is also an add-on code and it is revised code 93568 for non-selective pulmonary arterial angiography. The next is a new code 93569 for selective pulmonary arterial angiography unilateral. 93569 for selective pulmonary arterial angiography unilateral. Next is 93573 for selective pulmonary arterial angiography bilateral. Next is 93574. This is also a new code for selective pulmonary venous angiography of each distinct pulmonary vein during the cardiac catheterization. The next is 93575 for selective pulmonary angiography of major aortopulmonary collateral arteries MAPCs arising of the aorta of its systemic branches during the cardiac catheterization for congenital heart defects, each distinct vessel. It must be reported for each distinct vessel. The next is 93571 for intravascular Doppler velocity and or pressure devised coronary flow reserve measurement during the coronary angiography, including pharmacologically induced stress, initial vessel. Doppler velocity studies, including the induced stress. You need to report 93571. In the current session, let us discuss only one example. I understand that cardiac catheterization topic is little bit tricky and confusing. We'll try to gather couple of examples more so that you'll understand each CPT much more clearly. We'll make a shorter video with each of the type of catheterization shortly. This is a complete compilation of cardiac catheterization, excluding the catheterization for congenital heart defects. We'll try to make each shorter videos on each type of catheterization. For example, right heart catheterization, left heart catheterization, for better understanding. As of now, in the current session, we will wind off it with one example. Let us discuss the example. Left heart catheterization retrograde. Left heart catheterization retrograde from the femoral artery with injection procedures for selective coronary angiography and selective left ventriculorography, including the image supervision and interpretation with report are performed. Left heart catheterization and selective left ventriculorography is performed. We know that left ventriculography, whenever performed, it is included in the left heart catheterization. So the appropriate CPT is 93458 along with 26 modifier to indicate the professional component. Coming to the description of 93458, catheter placement in coronary artery with left heart catheterization, including intraprocedural injection for left ventriculography. When performed for coronary angiography, including intraprocedural injection for coronary angiography, imaging supervision and interpretation. Here, left ventricular catheterization retrograde from the femoral artery has been done along with left ventriculorography. So the CPT is 93458 along with 26 modifier. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.